Hello, my name's Dan Magnus. I'm a paediatric emergency consultant at the Bristol Royal Hospital for Children. So a few words on morale and job satisfaction, what it means to me, how I approach it at work, how I support trainees with this in practice. It's tough, isn't it? And in the NHS at the moment and in paediatrics, things don't always feel easy. But I think overall, the approach that I take can probably be boiled down to what I might call 3 Ps, an adaptation of something I wrote about recently actually in relation to leadership, but I think works just as well and is maybe subconsciously the way I approach this when it comes to morale and job satisfaction. So the first is positivity. There is always something positive and good that we can take from any situation, learning, encounter or clinical experience during our time looking after children and their families and working with our colleagues. And I think that focusing on the positive aspects of what we do in any given situation can go a really long way to ensuring that we maintain that sense of morale and some satisfaction in what it is that we're doing. Even the most difficult clinical situation or encounter with a family or the most difficult day at work can be framed in a way that can help us learn, become better at what we do, support our colleagues or the children and families with whom we're working. And maintaining that sense of positivity can always make things seem or feel better, even if on the surface things might appear to be very challenging indeed. The second P is perspective. Yes, it's absolutely vital that we bring our focus and our passion and our dedication and our professionalism to the workplace and to paediatrics and to that fantastic career and vocation and calling that we are all so privileged to be a part of. But never ever forget the importance of our health, our psychological and mental well-being, our friends, our family, who we are, and the things that really matter. Because I think that perspective will always hold us in a really good position when it comes to looking or viewing at the things that we're doing in our everyday work. And finally, the third P is pride, is remembering that whatever it is that we're doing at work, whether it's something seemingly trivial like writing up a drug chart or doing a blood test, or through to the incredibly important things we do with breaking bad news or working in a multidisciplinary team or dealing with incredibly complex situations that arise during our time as paediatric health professionals, we are really working hard, all of us, every day to make things better, to support our colleagues, to ease pain or suffering, to work with children and their families. And all of the time, the things that we're doing with the very best of intentions and with the kind of positivity and perspective that I've just mentioned previously. And so maintaining that sense of enormous pride in what we do, and it's a phrase that I know not everybody loves, but the sort of joy in work element that comes from remembering what an important thing it is that we're all engaged with. And particularly that's something I try to talk to my trainees about. Maintaining that connection with the positivity and the pride in what we do as paediatricians and in child health is something that will always stand us in good stead for doing the very best job that we can, for maintaining morale, not just for ourselves as individuals, but also for our colleagues and the teams with whom we're working, and really kind of maintaining that job satisfaction that we all need to keep us going through what can be very challenging times, but ultimately provides still what I believe to be one of the most rewarding professional medical careers around. Thanks.